My name is Dr. Harihara Murthy. I've got about 3 decades of experience as an ENT surgeon, and I'm practicing now with the Apollo Spectra Hospitals, Koramangala. Ear infections commonly are seen in the external ear, outside the eardrum, or in the middle ear, inside the eardrum. These are the common nature of infections that we come across. Commonly seen in the external ear are infections caused by self-cleaning habits. For example, people have the habit of using different types of instruments, which can be pins, pens, keys, ear buds. In fact, the buds are not even designed for cleaning the ear. So all these implements that are used to clean the ear is actually an exercise in futility, because the ear is a self-cleaning mechanism. When one chews their food, the movement of the external part of the external ear is sufficient to bring out the excessive wax and bring it out without your intervention. Only when we try to perfect what nature has done, we tend to cause problems, and you can have injuries which can cause infections. Besides, you can push the wax inside and injure the structures of the external ear. There have been instances where the eardrum has been ruptured because of energetic self-cleaning, because you're not seeing what you're cleaning. So these are the things that can cause infections of the external ear. Swimming in dirty ponds is another cause for infection of the ear, or swimmer's ear, which can be also identified as otomycosis. So these are practices which are not safe. Cleaning of the ear routinely with anything is completely proscribed. Coming to the middle ear infections, infections of the nose or the throat can track upwards into the ear and cause infections in the ear. So if a child is having any infection in the nose or the throat, or having a severe cold, or in a very small child between 2 to 4 years of age or 5, there can be tonsils and adenoids, which can be the harboring areas of infection which easily get driven into the ear. Blowing your nose very hard is not a very good idea, because that can also force bacteria into the middle ear from the nose. So treating the causes in the nose or the throat is a very critical aspect of preventing infections happening in the ear. Young children who have repetitive infections, which can happen in the school-going age in the early years, is a common factor for infections in the ear. So these children have to be treated for their primary problem, and their immune responses have to be bolstered by proper practices to ensure that the infections don't happen in the ear.